Hello, and a very warm welcome to today's Cell and Gene Therapy Insights webinar titled New Empty Fill Method to Enable Robust Manufacturing of AAV Products. I'm Caitlin Crouch, and I'll be moderating today's webinar. And joining me today is Aleš, who will discuss Sartorius BIA separations, new CIMmultus high reproducibility columns that allow for batch-to-batch and scale-to-scale reproducibility. After the presentation, we'll have a live Q&A session, so feel free to pose your questions to our speaker using the Ask a Question box at the bottom of your screen, and we'll try to get to them during the session. I'd also like to draw your attention to the Resources tab on the right, where you can find more information on the topics covered today. Now, I'd like to introduce our presenter. Aleš has been the Executive Managing Director of Sartorius BIA Separations since it was founded in 1998. He is one of the main inventors of the CIM-convective interaction media monolithic columns technology and co-inventor of many analytical methods, including pDNA, mRNA, AAV, adeno, and other viruses. He is co-author and author of more than 100 scientific papers dealing with separation and purification technologies, and is also a co-author of several granted patents. So, without further ado, I'll hand over to Aleš to kick us off with today's presentation.
Thank you, Kathleen, for the introduction. So welcome to everybody joining the seminar of today. And yeah, let me just go straight to the presentation. I already had a glass of champagne because we just finished with the celebration of our 25th anniversary. On this occasion, we opened a new building here nearby. Yeah, we are for 25 years around with serving of gene therapy market, especially working with different gene therapy molecules and viral particles. The first product actually which we introduced to the market were our monolithic columns. Before going to the details later on, just to give you an impression, where are we? We are located in a very small country, Slovenia, 2 million population living here. Very small valley in the middle of vineyards. We have very good vineyards here, worth to visit us. Maybe the easiest way to reach us is through Venice Airport. It's about an hour and a half driving to our facility. Quite the same from our capital, Ljubljana Airport. Otherwise, the nearest airport is Trieste, just 30 minutes drive to us. So we have been just 3 years ago acquired by Sartorius, so we are now part of Sartorius family. We just changed the name, adding Sartorius in front of BIA separations. So nowadays you can recognize us by Sartorius BIA separations. And we are keeping ahead with our main goal to serve gene therapy within Sartorius. We are now kind of center of excellence for these technologies, especially when it comes to the downstream. So our product portfolio, the first columns which we introduced more than 25 years ago actually are available nowadays from 1 ml to 40 liter. We also have smaller units like 96 well plates, 24 well plates, octet. I would say the main advantage of our columns is much higher recovery when it comes to very shear sensitive molecules. With measles virus can be even up to 3 times. And better recovery is always the main driver of the costs in gene therapy, also with vaccines based on shear sensitive molecules. In addition to this, you can also count on higher capacities using our columns. Would be even 100 times higher capacity for vaccinia viral particles. Maybe for AAV would not be really 100, maybe 5-10 times, depending on the other material you would be comparing our product with. The second family are our analytical solutions. We'll build it our own liquid chromatograph to really be fine-tuned for gene therapy and vaccine process development and manufacturing in process control. With our system, we will be using analytical columns based on monoliths, but also other columns can be connected. Very important, by us is also very strong development group. At the moment, we have about 120 experts for method development and process development. More than 25 years experience, very fast chromatographic columns and unique analytical technologies which we are using allows us to serve those customers who would like to develop their processes fast or very fast. We have vast experience with the pDNA processes for more than 20 years experience. First process was going on in Boehringer Ingelheim to produce plasmid DNA for clinical phase 3 trial. Nowadays, the process is basically more or less fixed. You can basically just buy our columns, get the manual, and you're ready to go to produce very pure plasmid DNA, which is very important to actually do transcription to mRNA with very low amount of double-stranded RNA. Mini-circle, doggy bone, mini-string DNA, very big plasmids, any size of RNA molecules, circular RNA, adenovirus particles, not maybe that much present these times. Adeno-associated virus, we have really a lot of experience with many different serotypes. Flu, vaccinia, exosome, bacteriophages, VLPs, recently also LMPs. So this is where we are operating. And so far we tech transferred more than 50 processes, DSP processes to many different CMOs worldwide. One of most known projects where we took part is actually Zolgensma. So Zolgensma, we were helping Avexis at the time to develop a manufacturing process, which was basically, which had to be scaled up from centrifuge to the chromatography-based process. Was really a very, very intensive work, very fast work, and within a year the process was developed, and it's now used to manufacture Zolgensma based on our columns. And especially I would point out here that for this process, cation exchanger is used, not the affinity resin. Yeah, when talking about AAV manufacturing, there would be more or less usual steps. There is no platform process here. I think it will still take years until we can even think about platform. So we really need to still work out basically serotype by serotype, gene by gene process. But if the AAV is inside the cell, which means we need to do lysis, then that would be kind of the process which we would follow in our labs. We also have a process which is based on OH columns, so hydrophilic interaction, but this only works with the AAV, which is bursted out of the cell, so it is in the supernatant. Most of AAV processes actually request the salt or detergent lysis. We prefer salt lysis, not to end with too much chromatins. Then the next step would be chromatin removal. Several approaches can be used, like flocculation, TFF DNA treatment, or recently solid phase extraction. If the titer is very high and the sample is not that problematic, we would go directly to the cation exchange column without any kind of concentration. Concentration would mean producing more chromatins and more issues and troubles to use the column several times or to basically get better recoveries. Then the next step can be affinity or cation exchanger. We prefer cation exchanger, provides better recoveries, and also usually it's cheaper. And then the polishing, there still can be ultracentrifuge, but more and more chromatography is used here as well. We developed 3 different ligands, the QA, a very strong anion exchanger, Prima S and Prima T, which are weak anion exchangers with some multimodal characteristics. If we remove the chromatin well, we would go directly to the cation exchanger, where we usually get already quite nice peak quite purified, some residual chromatin structures, still some histones below the AAV peak, but most of the chromatin is then sticking to the column and really need harsh conditions like 1 molar or at least half molar sodium hydroxide to prepare the column maybe for the next application of the sample. We did some comparison also with affinity approach, and once again, you can count usually on better recovery. It can be about 10% when compared to the affinity approach with other parameters quite the same. We are going to publish some of this data soon, so those who would be interested, pay attention on our newsletter. Empty full separation, that is kind of our old method. The sample which we are pre-purifying on the cation exchanger, we would be loading on an ion exchanger where we get kind of not that nice separation between the empty and the full, still some chromatin sticking here. So resolution, it is in the linear gradient, and to convert this in the step gradient is may not be so nice or so robust. So we are really working hard within the last 4 or 5 years to, first of all, allow step elutions and to improve the resolution. And this is more or less the topic of my talk today. Before going to the data, let me also introduce our PETFIX system, which has been really purpose designed to allow for much faster process development, to be orthogonal method to PCR, to ELISA. We know that no analytical method is accurate or is robust if you are working with very dirty samples. So it's really good to have orthogonal methods, not to make mistakes. What is so different with this liquid chromatography system? First of all, we have pump heads which are made of special material to allow sodium hydroxide and very high salt concentrations to be used basically permanently. The second thing, very important, is the possibility that we can connect any detector to this system. We developed a software which actually allows to connect any detector from any different vendor. And why many different detectors are needed? Because if you are just using QV detector, and in my presentation further on, blue curves would always mean UV detection 280 nanometer, the red UV detection 260 nanometer, the black would be always multi-light scattering detector. And then we have green, which is picogreen method, and protein, which is tryptophan excitation. So we have dual channel fluorescent detector as well. So if you inject just the crude harvest on the cation exchanger and run the linear gradient, you'd see a lot of peaks usually in the UV. But if you go with the multi-light scattering detector, the area, the peak is usually the biggest peak, which is usually present, would basically represent the AAV. And the area of this peak is quite good estimate of the amount of AAV in your harvest, actually even in the supernatant. So you can have kind of orthogonal method to the PCR when calculating the recovery of your process. We are able to work with a vendor such that we have very robust, very sensitive detector for just half of the price. Of course, this is then suffering with the measurement of the size of the particle. So we are not that much interested. You can still do such things offline with another multi-light scattering detector. And now going to the dual channel fluorescent detector, if we set the first detector towards tryptophan excitation, then we can kind of follow the removal of proteins. So how well we are removing proteins during the DSP, an orthogonal method to the Lowry. The DNA is a bit more tricky because the DNA is not fluorescent. So what we do, we put some picogreen to the sample, wait a few minutes, and the picogreen sticks to all DNA-related impurities, including the DNA itself, which is here not shown. And we can also look for DNA removal steps. We can use these detectors also for another setup. We always really like orthogonal methods. 25 years of experience is teaching us that with these complex samples, nothing is as it looks from the first glance. So what we do here, we centrifuge the material, just standard ultracentrifuge. We separate, in the case of AAV, the empty capsids would be more on the top, the full would be more on the bottom. If you now push the material after centrifugation with very uniform pressure through the capillary, which we put on the bottom, to the HPLC capillary, to the LC detectors, specific detectors, we can also detect the liquid coming from the tube through the capillary, through the detector cells, and we can also record signals. Again, UV signal, fluorescent signal, multi-light scattering detector signal, and then we can even put fraction collector after, so we can collect this fraction. We call this centrifugogram. So once again, this is not purified on the column, it's purified in the centrifuge. We just bypass the column and go directly to the detectors. And of course, we are using these methods and these tools to compare. The first goal was to compare the purity of the full particle coming from the centrifuge. So again, this is the very bottom of the centrifuge, and this is very top. So we are pushing the stuff through the detector cells, the multi-light scattering, the fluorescent, and UV 260 and 280. So we have signals. We may see some heavy, we will see some full, sometimes some partials, and the empty capsid coming the last from the tube, because it's on the bottom of it is on the top of the tube. So we decided then to take this fraction for UV2 for further analytics, and we also purified the AAV9 in this case, which is quite tricky to be purified with chromatography. So we purified this as well with our standard QA column. And we wanted then to analyze the quality of the two fractions of more or less purified AAV with the new method, which is charge detection mass spectrometry. Especially this picture or this graph is very interesting because we see the population of all AAVs separated by charge and by mass. You see it's a quite huge population. Empties are very heterogeneous, partials are maybe less heterogeneous, but of course the size of them is very wide, and the fulls quite heterogeneous as well, and there are some heavies in addition. So we sent our samples being pre-purified with cation exchanger to the company to do the analytics for us. Quite some empties, not that many partials, quite some fulls. So obviously our sample is quite different than the one shown before. And then we purified further this material with the centrifuge. So it is UC2 fraction. And now we can see that we could really remove a part of the empties and maybe a bit of partials, but there is still some material left. And we go further and compare this with our chromatography purified material. Also here we have concentration of the fulls, but still some partials, quite some partials, and also some empties. Seeing all these dots around, so was leading us to think that something needs to be done to make all these AAV particles more, let's say, homogeneous. So to do something on their surface to make them more homogeneous, because obviously the charge is quite different Okay, with the mass, we cannot do much if the gene is in or whatever it's in, but especially the charge, we can kind of maybe improve something. And this is exactly what was leading us to develop some new species which we are adding to the buffers. So if you compare our standard QA method, always running a linear gradient, let me point out that linear gradient is always more robust to know if something is changing. If you run step gradients, they are good for manufacturing, maybe easy to drive, but if you like to analyze things, you should run the linear gradient because in step gradient, you can easily get some empty in the full or some full in the empty. And if you then just kind of quantify through the peak area, you may be doing mistakes. So the separation here is not that good, not even baseline, but adding some species, which helps to kind of unify the surface of the AAVs, improves the resolution quite a lot. So empty is more or less separated away from the full. There would be some partials. UV is maybe not sensitive enough, but if you look on the fluorescent detector, the tryptophan one, we see a bit of peak here, similar on MALS. On MALS, you also see here some heavy capsids also on the UV. So we went with this method further. We did scale up and we collected the fractions. Like E1 should be more empty, E2 should be partials, E3 should be full, and E4 should be the heavy ones. And we took the fractions and we analyzed them. So now these are the analytical chromatograms. Just to zoom in of the fraction E1, we see quite pure empty. E2, there are partials of different, obviously different kind of properties or different charges or whatever. The E3, it's quite nicely purified full. We still see some material here, but we see even more material here with the fluorescent detector. So UV detector, fluorescent detector. We also analyzed these fractions by the dPCR, and in the full fraction in E3 we get kind of 70% of our material, but still quite a lot is in the fraction after. So some of the genes obviously are in the heavy capsids, and these heavy capsids usually would be kind of aggregates of destroyed AAVs. So we ended up with much better purity of the full AAV, maybe from like 70%. We are now depending on the detector. I trust more FLD, which would basically lead us to about 90% AAV full capsid. Still not good enough. We went further and we found some other species, and then we are basically combining two different species in the buffers such that we were loading the material on the column, and we were first running the gradient of the first species down to 0, and this allowed us to elute the empty. At the same time, we increased the amount of the second species to the maximum, and this was kicking out the partials. And then with just some more salt, we are getting out also the fulls. So this is UV detection, this is MALS detection, and this is fluorescent detection. We did scale up of this from 100 microliter column to 1 ml column. There is a lot of material, so we are not really playing with these columns. This experiment is already expensive enough. So if you now look on these elutions, so the empty, the partial, and the full, and you can even see the full peaks. If you do the zoom in, we see the two peaks of the fulls. So there is still something to be done here. But we analyze these fractions like E1, E2, the first peak, and E3, the second part of the peak. And we can basically really see that now either with E2 or with E3, which obviously are different, but at least at the moment, both are more than 99% 100% pure, not only from the point of view of empty capsids, but also from the point of view of partial capsids. So our goal is actually more and more to really get the partials and heavy material. Yeah, does this approach work with all the serotypes? We tested, so this was serotype 8. We also tested serotype 2, which behaves similarly. If the glycosylation of those would be different, they would be behaving differently. Then we loaded AAV9, and this was not that good, so the separation here was not that good. We did some further optimizations, and we are still not yet satisfied. We would like to go further, and actually we are already able to completely separate the empties, the partials, and the fulls towards the baseline. I cannot yet show this method, which will be shown as soon as we are ready to file for a patent. Yeah, if you are asking me now for a business model, you have two options. You can basically wait for the patents to be published somewhere end of next year, beginning of the 25, or we can kind of connect for a feasibility study, which we would perform for free, and we would then return you the sample, which we purify. If you see it is okay, then we can kind of strike a master service agreement, which would allow us to kind of help you with the development of your method. We will disclose to them, of course, all these pieces, and you would get kind of worldwide non-exclusive free of charge license. So through, let's say, kind of cooperation through the master service agreement, for which you just paid hours in our labs, you are able to be also on the safe side from the point of view of the license. Dealing with these methods and improving these methods was going in parallel to our other long-year project. Was running for more than 4 years, talking with quite a number of CMOs, not really happy to run linear gradients. We have decided to approach the need and to improve the column robustness from the point of view of batch to batch and scale to scale reproducibility, and we started to develop such columns. And actually, just today, on our 25th anniversary, we are introducing our new program to the market, first with QA, and then others will follow. So the idea here is to provide the column which will be really almost identical. Doesn't matter the size, doesn't matter the batch. Just to give you an impression how we make our columns, that you better understand why we were doing or why we're developing this new approach. So the monolith is always one single piece. We have a mold in which we put porogenes and monomers. The porogenes are there to make channels during the polymerization, and we add initiator and we start a radical polymerization. After polymerization, we take out the polymer, the shape and the size of the mold basically define the shape and the size of the column. We put then such a monolith to the second mold where we do surface chemistry, meaning pushing out the porogenes by ethanol and then pushing ethanol out with reagent, which introduce then any group, cation exchanger, anion exchanger, any affinity ligand. Also, immobilization of enzymes is possible. Immobilization of viral particles is possible. Channels are big enough. So after this is done, we cut the top and the bottom to basically prepare the height to fit to the housing. Worth to mention, the length of our column is just the thickness of the cylinder, which means in principle we are going to run a radial chromatography. So we put this into the housing and we test the column, and the column is ready to go. Our tests so far are based on ligand density, but before we of course, introduce the ligand, we first need to test if polymerization was going on well. For polymerization quality control, we are using mercury porosimetry. And if you see now, or compare the test of mercury porosimetry of our 1 ml epoxy monolith, 8 ml, 800 ml, 8 liter ml, we have quite nice overlapping of the pore or channel sizes in our monoliths. But the issue here, or the key problem here, is that mercury porosimetry is not very accurate method. It is more than 10% plus minus. So this method would not be good enough to really qualify our columns to be really batch to batch and scale to scale reproducible. So we have first check, but obviously the qualification of the column to be not 10% or plus minus, but much less, needs to be based on something else. And this something else was for many years ion capacity. When we then started to discuss with some CMOs how to convert the linear gradient to the step gradient, we performed a study in which we basically measured the ion capacity and compared this with the amount of the salt which is needed to kick out empty AAV capsid from the column. Quite some tests. The main result, or let's say the main outcome of this study, was there is just no correlation between the ion capacity and the amount of the salt which is needed to elute the empty or the full AAV capsid. Which means if the columns are qualified with smaller molecules, we may not be able to really produce them and release them, especially, or qualify them to be good enough. So we had to really think further. It looks that no small molecule would be possible to be used, and we tested some other approaches, and it was quite the same. So small molecules are not representing the column when it comes to the question of robustness or of the property of the column to separate viral particles or big nucleic acids. On the other side, we cannot go to the big column with something which is not small, because it would be probably more or less organic stuff. So we have started to think what to do, and we came to the idea similar to the columns being packed with porous particles. You are buying 100 liter of the resin, and then you usually would take 10 milliliter or 50 milliliter of this resin, pack small column. If small column performs well, then you conclude that also the big column will be okay. So you pack the resin to the big column and you go with your purification. Yeah, we are basically thinking similar. We are already cutting the top from the cylinder and the bottom. So what we did is we cut it out from these rings, smaller discs, from here, from here, from here, as well from here. So we ended up with quite a number of discs, which we inserted then in the ring, and then such a disc with the ring goes to the small housing. All this we call now specimen, meaning a small piece of the monolith which should represent the property of the complete column. If this is the case, and if we perform the separation of empty full on such a small column, we should be able to conclude that also the big column is okay, and we can release it to the market. Yeah, so we compared these small specimens of 200 microliter size. And now this is easy to compare these columns like 80, 800, 8 liter, because we always work with 200 microliter specimen. We don't need to worry that the system running 80 ml column is different than 8 liter, because also the system may influence our elution of the empty or of the full. Once again, we always run our empty-full separation in linear gradient because it is more precise, it is more sensitive to changes of the columns than if you put the step gradient. Yeah, and if you overlap now the specimens, you can now easily basically select this valley to be your step. So you can then convert this linear gradient to the step gradient. So your three columns are really robust. They're almost identical. So you can basically switch this linear gradient to the step because the two peaks are not moving. Yeah, of course, we need first to prove that the small disk is representing the complete column. We did a lot of tests here. I'm just showing you a few of them. So the disk from the bottom, the disk from the top, we are running the elution of empty and full AAV 8, and at the value of salt 9.254 millimolar, we are able, plus minus, we are able to elute the empty AAV capsid. So the disk from the top, actually two of them, and this is kind of the average of the two. Also from the bottom, again, two are basically within the acceptance criteria which we set. After this, we basically inserted the monolith to the housing. We are running the same AAV separation with the same sample, everything the same, on 80 ml column. And we see that the amount of the empty, so the amount of the salt to elute the empty capsid is basically within the acceptance criteria set. So it is the two disks, the one from the top and from the bottom, are representing the complete column. To be further on the safe side, we also cut it. So we took the monolith out of the housing. We further cut it some more rings, and from these rings, again, small disks, and we analyze them as well. And we see nice homogeneity from the bottom and middle and the top. So the small disk represents the column. Quite the same we can see with bigger column, like 800 ml. So again, the disk from the bottom and from the top represents the column. And also, if we cut further O-rings, we see that the column is homogeneous. What we had to change due to the void volumes of our housings, 1 ml, 4 ml, and 8 ml, was the dead volume. So we redesigned the 1 ml, 4 ml, and 8 ml units to basically fit to our bigger columns. With regard to the dead volume, we need to take into account that even the dead volume of the housing may influence the separation of empty and full, meaning also the elution of the empty capsids, which we are selecting as a release criteria. So the height were changed, and basically the measures of the changes are here. So if you would like to go now with our HR program and start with small prep, make sure that you have HR columns in your hand, not anymore just CIMmultus column. If you now overlay all these specimens, which we already have seen before, with the three new columns, 1, 4, and 8, and these three ones are actually, so we are injecting the empty and full capsid directly on the column. The amount of the material with these small columns is not enough to make specimens. But these are small columns, will not be cGMP, so we can even go with AAV on them. If you overlay all this and normalize on the isoconductivity, basically the valley is quite on the same spot. In this case, we had just 0.4% deviation of the elution of the full, the salt deviation, but our acceptance criteria we set now to be on the 3%. It's very tough to really be below 3%. Already analytical method we are using, this one, is not more accurate than plus minus 2%. So we cannot release on the market something which where analytical method is not accurate more than yeah. So whatever you release needs to basically always take into account the analytical method's accuracy. So this is now our standard typical chromatogram, which will allow us to release the column. So how this goes on, we produce the column, we test the specimen. If the specimen is within the criteria set, or the column, small column, at the moment with AAV, which we produced in the house, the release criteria is 92.3 millimolar plus minus 3%. This probably would change with the new newly prepared AAV batch. There are always some small differences, but of course, then we need to perform bridge study. So we would be releasing the column to you based now on the separation of empty and full. So we are trying to provide you with much more robust columns from batch to batch, scale to scale. This is about 5 times better than it was so far. So far, we would be at around 15%. But yes, this can only be done if we qualify the column with the AAV itself. The small molecules do not represent the column properly. Yeah, there are also other parameters, of course, which you need to take into account when dealing with empty and full separation. First of all, the amount of the AAV you load on the column. You see that increasing the amount is moving both the empty and the full to the left, also the valley. So this is linear gradient. If you would basically plan to have step gradient here with more loading, the step gradient would not anymore work. You would be losing your full AAV, and your recovery instead of maybe 80% would be only 40% because you are loading too much, which means if you'd really like to set the valley properly to turn it to the step gradient, you need to load on your small column quite an amount of the material to be close to your working capacity. So once again, make sure that you always load similar amount, not the same, but at least similar amount of the material at any other scale. So similar amount per 1 ml. So then you can be quite straightforward. So here are some more details. Yeah, also the buffer preparation may influence the elution of empty and full and may shift the valley. So make sure that your buffers are properly prepared. If the column is not properly equilibrated, for sure there will be no reproducibility and no robustness scale to scale, batch to batch. The temperature, just going from 23 degree to 30 degree, it moves the valley a lot. So, or the empty capsid elution a lot. So make sure that you develop your process with the set temperature, and be aware that if the temperature is going down or up, this will influence your elution. Sometimes even moving from one detector to another detector may move your valley. Some detector cells would have bigger void volumes, some lower. UV detector plays different role than fluorescence. If you basically first put fluorescent first, UV second, and then next time UV first and fluorescent second, you will for sure be missing the valley. And of course, one of the key drivers when it comes to empty-full separation is the void volume of the system. If your void volume is not scaled up or scaled down with the column, then you may easily shift the valley a lot. So this is a chromatogram, elution of the empty, elution of the full, fluorescent detection, compared to the small prep, and you see how much the empty and the full are shifting. Always linear gradient, yeah. You may not see this in the step gradient because if you basically put the step here, you will not have any purification. Yeah, just to conclude, just on our 25th anniversary, I'm happy to kind of announce that we are coming with the new HR product line, which will be far better from the point of view of batch to batch and scale to scale reproducibility. The QA is our first column, but others are follow. The Prima S should follow by the end of the year, and the next year some others are coming. So depending also on the applications, how tough is something to separate, we'll be introducing new chemistries. Maybe very important to say is that our standard QA program is just the very same as our new HR program. The only difference is actually the way how we release the column. We are throwing away about 50% of our columns because they don't fit to the criteria. But from the point of view of polymerization, from the point of view of surface chemistry, it is just the same material and also the same drug master file we provide for this stuff, which means you can, even if you are ready, maybe in clinical phase 3 trial or maybe already on the market with your product, you can replace our old program with our HR program. Yeah, the new criteria is based on the conductivity of the AAV elution, not on a small molecule anymore. We also would provide you a specimen with the big columns, so you can kind of double check us, our testing, or you maybe convert this testing to your own AAV. And this is replacing our old test based on the small ionic groups, which do not represent the column properly if you'd like to have a robust scale up, scale down things. And the acceptance criteria are now based on the conductivity plus minus 3%. And with this, we can really offer 5 to 10 times. So with this, we can really offer 5 times better robustness. And with the new methods which we are introducing, we can also improve the resolution. So there are 2 different things which should really make your life when dealing with empty full capsid separation, purification, and especially the partials, which may be much more problematic. So your life much easier. And the novel methods and also the HR program has been now tested also on the big columns. And from today on, the HR columns are ready. The QA HR columns are ready, and basically can be bought with our standard delivery times, which means 1 to 2 weeks for small units, and for CGMP compliant units within 6 weeks. Worth to mention at the end, we are running every second year the symposia in Porto Roche. Next one is going to be from June 3rd and 7th, where I believe some of our customers are already going to present their data with our new HR columns. And there will be a lot of other stuff. And keep in mind, we have some great vineyards here around, and also food is not that bad. With this, let me thank you, and I'm open for questions. So, Katie, please go ahead.
Great, thanks, Aleš. If I can just ask you to just stop sharing your screen for me and then switch your camera on. So thank you for a great presentation. We're now going to start our Q&A. Please do keep your questions coming in. We'll get to as many as we can during the webinar itself, but any we don't get to, we will answer via email. So our first question here asks, would it be possible to achieve reproducible purification of AAV full capsid using QA-HR even if step elution is used?
Yes.
Fantastic. So our next question here asks, is QA-HR already available to purchase in all sizes? Also see GMP columns. What is the delivery time?
Yeah, well, from today on, the HR program, the QA-HR program is basically available as any other column. QA/SO3, usually 1 to 2 weeks for small units, and CGMP compliant units up to 6 weeks.
Brilliant, thank you. So our next question here asks, have monoliths already been used in purification process of any commercial gene therapy product?
Yes.
Fantastic. Our other audience member here asks, why would you think that it's possible to achieve better AAV purity with monoliths compared to resins?
We made so many comparisons so far, so I'm always saying to everybody, please compare everything what you see on the market and then decide on what the best is for you. But we did a lot of comparisons here, and I'm perfectly sure that the monoliths is going, the new HR program is going to, with the new methods, is going to perform far better than any other material available on the market.
Brilliant. So our next audience member here asks, is there a difference in purity and recovery when comparing performance of traditional QA with new QA-HR columns?
The recovery, if the method is kind of working the same, the recovery should be the same. So you are not losing more or less material because of HR. It's really just that the column would be scale to scale, batch to batch, more reproducible. The other properties would be the same.
Brilliant. Thanks for answering that one. The next question here asks, what is the difference between pores and channels?
Channels are really throughput pores. So whatever goes in the channel is basically flying like in the river. The pores request diffusivity. So in the channel, the mass transport between stationary and mobile phase is based on convective mass transport, which also kind of help with the resolution, because diffusivity is always working against resolution, especially with big molecules. You need quite some time for the molecule to travel to the pore and out of the pore, which makes your band or your peak wider. The dead pore, yeah, it's really dead pore. So the molecules in your mobile phase needs to go to the dead pore by diffusion. So the key difference, I would say, is the channels provide mass transport of molecules based on convection, and the pores need diffusivity.
Brilliant. Thank you for providing that information. I'm sure that was very helpful to our audience. Our next question here asks, how many QA-HR columns are outside of criteria? Are those columns then sold as normal product, not as HR?
We have about 50%, let's say, yield. And some of this would then be still okay, would be with the criteria for ligand density, which we measure with ions. And this would be then, yes, offered as our standard products, but some of them needs to be thrown.
Great, thank you. The next audience member here asks, is this available for AAV8 capsid only?
Sorry, can you repeat the question?
So the audience member asked, is this currently available for AAV8 capsid only?
No, the HR program just works for just any serotype, any chimera. If you have some surface modification antibodies on them, you can also work with adenovirus. It is a property of the chromatographic resin, which we measure by particle instead of small molecules. But once you basically measure the property with something which is very big, there will be not really differences between the particles, although they are of different serotypes or even if they are different sizes.
Great, thank you for answering that. Our next audience member here asks, is the new method applied on the new QA-HR, can it improve full/empty separation on the old QA monolith column?
The HR column is not going by itself to improve the resolution. It will just make sure that the resolution you gain will be possible to run on any scale, on any in any new batch. So the HR column does not improve the resolution when compared to our old column. You need also to have new methods in place to improve the resolution.
Great, thank you for that insight. I think that was really beneficial to our audience members. Another question here sort of follows on from one earlier, and it asks, which AAV serotypes were tested with the novel CIMQA so far?
Yeah, one of the slides, last slides I had, we tested 8 and 2, which behave similarly. AAV9 behaves differently. So with AAV9, we had to go further and invent some new species to be able to improve the resolution. This one I'm not showing yet. Probably will be able to show this method within like 2 to 3 months after the patent is filed.
Great. So sort of following on from that last question, another audience member here asks, have there been any efforts to test the new QA methods with AAV5 serotypes?
So far, we are not testing it because in our company, we express only AAV2 serotype, AAV8 serotype, and AAV9 serotype. We don't express AAV5. Having experience with serotypes, so far, I would believe that the combination of the species which we are using will basically provide also very good separation of any capsid, not only empty full, but also of, or that it will be possible to get rid of partials and heavy capsids as well.
Excellent. Thank you for answering all those questions, Aleš. Unfortunately, that is all we have time for today. So any questions we didn't get to, we will reply to by email. The webinar will also be available on demand from tomorrow. So please do look out from an email with us with that link. And all that's left to do is to thank Aleš for a great presentation. And thank you to you, the audience, for listening. We hope you'll join us again soon.
Thank you all.